Presidential candidates remain split on the issue of health care reform. Meanwhile, on the Democratic side, Hillary Clinton aims to continue the policies set by President Obama, while rival Bernie Sanders is saying American health care should be upended and made into a single-payer system. On the other side, most Republican candidates are looking to dismantle Obamacare entirely. Joining me right now, Universal Health Services Chairman and CEO, Alan Miller. Alan, good to see you.
Good morning.
Thanks so much for joining us. Actually, Obamacare has been a positive.
It's been good.
Yeah, for your company.
Basically, they've covered many more people who had no coverage. So it's somewhere between 10 and 20 million people, which reduces our bad debt, and we get people that pay for services. So that's good.
And what are you expecting in terms of how this plays out, how this may change? Do you have...
There's a lot of good things in Obamacare. More people are covered. People cannot be refused coverage for pre-existing conditions. A lot of good things. The problem is how do you pay for it? And that's where we are.
Yeah.
I think that will have to be dealt with later on. But basically, it's got a lot of good things. A lot of people like it. Certainly the people that have been covered like it.
But what about the premiums going up?
Premiums that's the bad side. Premiums are going up. People who have to pay those premiums are surprised because they were promised that the premiums wouldn't go up. So, you know, you have to pay the piper at some point.
But nobody, the whole idea was that this was going to be good for everybody. Well, when premiums go up, I mean, there are families who cannot.
It's hurting individuals.
Exactly.
Well, of course, you know, free is good, but they always say when it's free, you're going to pay more.
Free is great.
Yeah. So. Except nothing's free, my mother told me.
So that's probably true.
Bernie Sanders says college is going to be free.
And why did I work so hard?
Michael.
So, Alan, I'm a stocks guy, and obviously healthcare stocks have been under a little pressure with the overall market. But one of the bear theses in your sector has been that all the increased activity from the Affordable Care Act, a lot of that's going to lapse, so to speak, so the comparisons are going to be tougher. What is Universal doing to address that?
We are diversified. We're in acute. We are probably the largest in the U.S. in mental health. We're in the U.K. We bought two wonderful companies in the U.K. Hate to use that word, but we bought two solid companies in the U.K. So we're diversified. But all our businesses are growing. We just released our earnings. We're over $9 billion in revenue. We're 125 million up, around 700 million after-tax earnings. So we're not complaining.
And the margins expanded in
Margins are expanding. Yeah. We've had a very solid result. The other thing is we're slower than the other guys in debt. We're 45% debt. A lot of the other companies, as you well know, have been 70, 80. They're running into problems. So we're the slow guy who's just solid.
Well, if some of those guys may be running into problems, do you see any opportunities out of that rubble potentially?
Yeah, we're not a vulture, but if, in fact, they have to do some things and raise some money, we have money, and we're happy to do it.
But with the presidential candidates, I'd say almost all of them are promising to change Obamacare, do something. Bernie Sanders wants to go full Medicare for everybody, even though that is a bankrupt program that's going to start running out of money.
And it doesn't work, by the way.
Right.
They've had it in Sweden. They had it in Vermont. It doesn't. Single payer does not work.
Thank you.
Why doesn't it work?
Because you wind up, well, first of all, it costs a fortune. So in order for the countries not to go broke, or the states, like Vermont, had to cancel it, they have to raise taxes. At some point, they can't raise any more. At some point, the way they handle it is they ration, and people don't know about that. You can wait 18 months to have some sort of an examination in the UK. So it doesn't work. And why he's educated, why he would go to that. Even Mrs. Clinton is not into that. It just doesn't work.
So the growth at Universal Health comes from where, if you look out 2 or 3 years?
We are in markets that are growing fast. We always have been, growing faster than the U.S. That's where we put our hospitals. That's what we've looked for. We grow at 2%. The government, U.S. grows at 1%, and we've done that since the beginning. That was our strategy.
What's the fastest growing market right now?
We're building a hospital in Las Vegas. It's one of the fastest growing. This will be our 6th in Las Vegas. So we've done great with Las Vegas, and it's done great too.
Wow.
Excuse me?
Outside of the United States, where's the
We're in the UK, and there's a lot of growth in the UK.
Does it leave the EU, you think? Do you think Britain leaves?
I don't know.
Yeah.
I think it would be a mistake if they did, but we'll see. If they leave, it doesn't matter. We are in mental health. People still have problems, and they have to be covered. The government doesn't do it that well, so they have been working with us in the private sector, and that's why we've done really well in the UK.
Do you have any thoughts when it comes to mental health in terms of these shootings that we've seen? I mean, the mental health issue has come up a lot on the campaign trail.
I don't know whether it's just the fact that we have 24-hour media. I mean, I assume this has gone on before. People have had guns in the U.S. forever. And it's not the guns, it's the people. I mean, so
exactly.
I don't buy that.
Alan, good to see you.
Good to see you.
Thanks so much for joining us this morning. Alan Miller joining us, their Universal Health Services Chairman and CEO.